This feature is brought to you by JPHMP Direct, an online community for advances in public health, the companion site of the Journal of Public Health Management and Practice. Today we're joined by Camelia Singletary. Camelia received her master's degree in public health from the University of South Carolina in 2015. Her research interests include exploring the implementation of school physical activity programs in combination with nutritional components. She's also interested in analyzing the adoption of physical activity and healthy eating skills from a social cognitive perspective. Camelia joined JPHMP Direct in 2017 and has been the host of our popular podcast series, Public Health Perspectives. Today, she gives us insight into the podcast. Hi, Camelia. Thanks so much for joining me today. I'm really excited about talking about Public Health Perspectives, your podcast series that has been really popular. Tell us a little bit about how the series got started and what inspired you to develop it.
So I've listened to podcasts for a while as a medium for gaining knowledge, mostly true crime, but I thought it would be a good idea to produce information in this form for people who are on the go. The podcasts are relatively short, and we provide quality narratives for people or professionals or students who are in public health. And the podcasts are also easily accessible on multiple platforms. And what I really wanted to do was to provide a resource that I wish I had as a student. Upon graduation, I had no idea what I wanted to do, nor did I have the experience to get hired in my field. So I've been working in the field of public health for about 4 years now, and I've had the chance to meet and correspond with those who have unique positions some that I've never heard of. I wanted to find a way to provide an outlook into that by inviting various professionals to talk about their career paths. The idea is that if someone is out there wondering how they would combine their skills to be a public health professional, they can come across the podcast and get an idea from one of the guests on a potential path that they may not have thought of before, or that they may have needed a real example for.
So the program is geared toward MPH students and early career public health professionals. What are some of the decisions students and early career folks are facing when they enter the workforce?
So public health covers such a broad spectrum of circumstances and conditions. And with that being the case, students are faced with many paths that they can take and finding out exactly where they fit in the field. And for me personally, I did not have very much experience. And that was coupled with the fact that I didn't quite know how many avenues there were for me to even take. And even now, I'm still creating a very unique path for myself.
A new report on the Public Health Workforce Interest and Need Survey by the de Beaumont Foundation and AASHTO has found that nearly half the workforce intends to retire in the coming years. What can listeners of your podcast learn about the upcoming challenges and opportunities that may exist as a result of these shifts in the workforce?
As listeners get the chance to hear about the paths of others, they get a glimpse into what a job requires, advancement potential, and prominent topics of concern. From there, students and professionals can potentially begin to think about innovative ways they can contribute to topics that truly engage them. The hope is also that there are listeners that will have a more formal training in public health. Many in the governmental public health workforce tend to have remarkable skills that have been built from a boots on the ground approach. But the future of public health will be moving towards a more formal approach as far as research and development of programs is concerned. And before these people with this immense knowledge happen to lead the workforce, we want to make sure that they're able to pass that knowledge down to those who are going to be filling their shoes.
Yeah, that's a really important point. As the podcast approaches its first anniversary, what are some of the important pieces of advice your guests have shared with listeners?
The podcast is technically geared towards strengthening the workforce, but some of the most important information I feel has been given about life in general. So messages that encourage students and professionals to sharpen their skills and kind of blossom in their current positions, to be compassionate, be unbiased, be mindful, take care of mental and physical health of themselves and others, and building confidence in their ability to make a difference are some that kind of stand out to me.
So what's in store for 2019?
We, the journal, and the podcast will continue to fine tune what we provide to our audience, whether it be students or professionals. Our team is continuously learning new skills to provide clear, concise, and evidence based information in an attention grabbing format. We have a few upcoming episodes. One is going to chronicle the narrative of Dr. Benedict Truman, who's an environmental intelligence service officer with the CDC. And then the second is going to be with actually a student of public health and an ambassador for This is Public Health, which is through ASPPH, and his name is Noble Salwan. So we have that coming up as well. And then for anyone who's interested in sharing their story, please feel free to reach out to myself or anyone at the Journal. We'd love to hear from you.
Great. Thanks so much, Camille. It's been a pleasure talking with you.
Thank you, Cheryl.